Implant FMR is the most expensive treatment in dentistry, and passive fit is what every dentist dreams of even in 2025. But we have a solution now. TUPEL 3D photogrammetry implant scanner is changing the way full mouth implant dentistry is done, with passive fitting restorations across the world. As a first step, once you make an appointment for a full mouth scan, our person will come with an intraoral scanner and a TUPEL scanner with all the scan bodies needed for a scan. And then the scan is performed and sent to the lab. And now let the magic begin in the lab. So let me take you behind the scenes and show you the entire journey from the moment the scans are received to the dispatch of the prosthesis. Let's start. First, the scan files received from the doctor are imported here in our system, and we have a dedicated software for registering the case with all the details that are mandatory for the case. And if 100% information that is needed is provided, we can proceed to the scan verification and the CAD design process. Now let's move ahead and see how our technical expertise turns digital scans into life-changing results for the patients. As you can see, this is a case of an all-on-4 implant prosthesis for both upper and lower arches. Here, the data obtained from TUPEL 3D implant scanner and the intraoral scanner are merged together. Here you can see two different colors clearly demarcating the position recorded by the TUPEL 3D implant scanner and the intraoral scanner. This is where the entire magic of TUPEL 3D comes into play. Without TUPEL, this level of accuracy would have been impossible to achieve. We go on, complete the design of the 3D model, which later gets printed in our state-of-the-art 3D printers, which are accurate to the tune of 25 microns, and we also use a special resin for implant restorations to have super precise implant models. Now let's do the most exciting part. This is where the design of the prosthesis takes place. We will begin designing the prosthesis now. We have selected the implant system and all the other reference points provided. This step is extremely case specific, and the prosthesis is designed as per the anatomy to achieve the best possible result for the patient. Here we are not just going for fit but also comfort and aesthetics. That's it. Now your prosthesis is ready for milling. Let's start making it. The next step, we need to ensure that the zirconia DMLS peak. We have all the choices which will be used for making the prosthesis, but in this case, zirconia is the selected choice for the material. Simultaneous 5-axis milling will be done by our state-of-the-art milling machines with precision tools from 2 mm to 0.3 mm to mill a very precise restoration. Once the milling is done, the prosthesis is ready for sintering, where it's heated to 1350 degrees and takes close to 15 hours to achieve the strength of 1200 megapascals. So now for the final step, it goes to our master technicians, where he will make sure that, like he's checking now, the color is perfect. He will give some more characterization on the incisal to make sure the incisal translucency and all of that looks beautiful. At the same time, then he will make sure he will take a little bit of cervical stains to give that little gradation that is needed for it to look natural. Post that, also similar gradation will go interdental so that the separation is even more highlighted. And then finally on the occlusion, where we'll take a little bit of stain and make it more natural looking to make sure that when the patient wears this, it looks absolutely natural and beautiful. From fit to occlusion to aesthetic, everything will be checked here on the 3D printed model that we had put in the printings at the step 2 of this workflow. This is where you see the real impact of this technology in action. Look closely. Can you see the prosthesis has achieved a beautiful passive fit? See how seamless it is. It was all possible because of the level of accuracy that TUPEL provides, which is 9 microns and 6 microns respectively. During our conventional digital implant workflow, we usually make necessary adjustment at this step, but with TUPEL, it's not needed anymore. Let's move ahead. Once we are happy with the prosthesis, the glazing is performed. So from incisor to the interdental to occlusal, using characterization, we ensure that your patients are getting natural looking restorations. Post the glazing is done, the final QC is performed and the prosthesis is now ready to be delivered to you. For dentists, at Illusion, we just don't make prosthesis, we care for our dentists and their patients. And like we always say, your growth is our success.